Hello, my name is Nyla King, and this presentation is on the role of glycoproteins in adhesion. An overview and general information. Glycoproteins are proteins with one or more carbohydrate groups, and they're covalently linked to amino acid side chains. They connect cells that are on the extracellular matrix. They maintain plasma membrane by stabilizing membrane structure, and they bind proteoglycans and collagen molecule receptors on the membrane surface. The structure and various proteins that are involved include collagen. It's the most abundant glycoprotein, and it's on the extracellular matrix, and it's made up of high-strength fibers. Fibroconnectin is another, and it binds cells on the extracellular matrix. It determines cell shape and guides cell migration. The basal lamina is a thin sheet of extracellular material that separates epithelial cells from connective tissues. And another two are cadherins. They mediate calcium-dependent adhesion between cells. And neural cell adhesion molecules also are involved in bundling of axons. Okay, and the collagen, fibroconnectin, and basal lamina are all considered integrins on cell surface receptors that bind to the ECM. Okay, so for the specific location in an organism, cell and physiological function, and the role, so they're located on the extracellular membrane, and they function in immunology and protection. So for the immunology, they're basically associated with white blood cells and how they handle immunology. And for the protection, there's a need for organs to secrete mucus to function properly, and they're also on the surface of the skin as a protection barrier. Okay, so for the disease associated with the malfunction is called Schindler or Kawasaki disease, and it causes neurological issues. So there's three different types. Type 1 is the most severe, and it's called infantile type 1, and it causes infants to lose skills around 8 to 10 months. And there's type 2. It has cognitive impairment and hearing loss. And then type 3 is kind of an intermediate form. It develops delays, behavior problems, enlarged heart and liver, among other problems. So basically there's a mutation in the NAGA gene that disrupts the alpha-N acetylgalactosaminidase, apologize for that, enzyme role in breaking down glycoproteins and glycolipids. Okay, so for some recent findings about the topic from a primary research article, it has to do with the hepatitis C virus, so basically there's a continuous mutation resulting in E1 and E2 envelope glycoproteins that are targeted by neutralizing antibodies and help HCV to evade humoral immunity. So ultimately, they feel there's a need for a better antiviral therapy and vaccine that better understands how antibodies interfere with the virus of the CD4 helper T cells, and the failure during infection is needed. Alright, and a question I have about the topic is, how are glycoproteins formed? Basically, where they originate. Alright, that concludes my presentation. Thanks.